So welcome, Beth. This is what I want to first do is just give everybody a little bit of an idea of who you are in all your brilliance and beauty. Beth is MD. She's board certified OBGYN. She is certified in functional medicine. She is, I'm going to get the next part, a yoga, Ayurvedic yoga instructor.
Health coach.
Health coach. Sorry.
Yeah.
Health coach.
Sorry.
She is living in Arizona. Beautiful. And she's an athlete herself. She loves all aspects of being athlete, swim, bike, run. She was at this beautiful pool that just made me like just drool in how it was just, the in Sedona, and it was like the mountains are in the backdrop and just the blue of the water, and this is thriving, right? Like just like it's a peaceful place of just such elegance and just gorgeousness of just water holding you. It's just such a home. It's a place of home for me. But in any case, we are going to, anything else that you also have a fabulous community that I want to make sure that we talk about. So what is the community and its name? How do people find you?
Flagstaff Functional Medicine is my website, and Let's Talk About Menopause is my Facebook group.
Fantastic. Let's talk about menopause. So you have the right person here with us today. We're talking about blood work.
Yes.
Because what is something that is really, really important to me is that health is the foundation of performance. Mm-hmm. And as in my own history and in my own journey, I didn't maintain my health. I just went for performance. I just was like all performance to whatever sacrifice was going to be worth it, because at the end there was going to be glory. Well, it didn't work out so well. And now it is my whole life's mission is to really understand and support athletes to gain the performance, to get to their goals, to achieve what it is that they're after by staying in health and adding on that performance angle if that is something that they wish to do. One of those ways that we do that is through understanding our baseline of health. Mm-hmm. And so there's a number of components of understanding the baseline of health, of which blood work is one of them. I'll just list off a couple of others that Beth and I talk about sometimes. It's DEXA scans, it's metabolic health testing, it is looking at VO2 max, it's looking at your functional movement screen and understanding what are some of your strengths and your weaknesses. As just a couple of things that, go into this integrated health package that I can't talk about quite yet, but let me tell you, it is coming. So if you want to know how we're doing this and how it is that we can bring this into your training and to your ability to do this, then you're in the right spot, and stay tuned. So Beth, where we're going today is to understand, when do we do blood work? Mm-hmm. Why do we do blood work? And how often are we going to do blood work? Like what's the most important components of, and why do we actually do it? So is that a good start?
I think it's a great start. And I was really just thinking about this. I was just finishing up a couple of charts from people that I saw yesterday. When do we do blood work? I think anytime is a good time to do blood work. Anytime that you're ready to know the truth. Because blood work exposes our genetics. It exposes our imbalances. And oftentimes there are things that we don't know are out of balance. Maybe some people know that something's kind of off, and doing a full battery of blood work like I do, not just like a comprehensive metabolic panel and CBC, maybe a couple of things, but a really comprehensive battery of blood work. I like to find abnormals. I want to find abnormals. They let me know, like, they're like the guardrails, like, where are we going outside of the lines, and where does this person need support? Because, in functional medicine, we don't we love to find diabetes before it's diabetes.
Yeah.
We love to find autoimmune thyroid disease before it's Hashimoto's, before it's Graves. We love to find imbalances in the CBC, the white blood cell count, before it's off the rails and crazy inflammation. So we can reel it back. So we can make those changes, turn those knobs, just small adjustments to reel things back. So it's like it pulls back the veil of like what's really going on.
Yeah. And that's all in our blood.
Yeah.
Our blood tells us all those things.
It can tell us a lot of things. And then there are things that I can see in blood work that I know, oh, there's got to be a genetic reason for this. This is like way outside the realm of what's normal and what's just likely a little imbalance to like, we've got genes working against us here, so we need to double down.
Double down in understanding, okay, so where is that? And I think this is where this is super cool. Okay, so the blood work is going to give us insight into a whole suite of how is your body running. Like it's the what it blood is bringing us the nutrients, it's bringing the oxygen, it's bringing us everything we need to actually survive. This is why blood work is the important part.
Yeah, and it's taking away the trash. And it's exposing the imbalances. It's exposing the inflammation, the oxidative stress, the things that aren't good, the things that are floating around in there that will cause fires.
Right. So I love this because I don't think I've ever actually really talked about this. I don't think I've ever actually asked these questions. So you get your blood, you're analyzing it for what is, so if we look at, so for example, vitamin D, what is your vitamin D count? You get a sample, and from that you say, in this parts per whatever the measurement is, we understand that your vitamin D is X. Is that how it works? Yeah.
That's how the lab reports it. And then usually, especially in functional medicine, a lot of the test results that are reported are normal because actually what the lab reports normal, what's in range, what their normal range is actually the bell-shaped curve of all the people's labs that they draw. So since our culture tends to be more and more unhealthy and becoming, has a higher incidence of thyroid disease, has a higher incidence of diabetes and obesity and heart disease, we're seeing normals as like, really they're abnormal. Right. So they're reported in the normal range for the lab, but they're not healthy. They're not optimal.
So this is fascinating, right? So here again, like it's not only just that we are not just looking at the white male that is 20, to 25 years old. Now we are looking at a whole population that is also not, ideal. And I guess this is where what I've been doing a lot of work in trying to understand lab work. And why is it that like, what is the difference between running labs between, say, you and I have talked about what you run in terms of your lab work, which is a really extensive look because you are in functional medicine. You want to find the abnormalities. You don't want to just say, okay, everything is in check. You want to be like, is everything in check? Like, like, are you really? Because one thing I think that what's interesting about functional medicine is like, one thing will throw another thing off. So you're trying to figure out what that one thing is that is a precursor to throw the snowball that might come down the line. Like, sure, everything is looking, it's just like looking down, it's just like, yeah, no, everything looks good, but you didn't look at the the scum at the bottom of the pond that was starting to grow. And all of a sudden the whole pond is like super murky, but the top layer looked beautiful with all the lily pads. That's the difference between functional medicine and traditional. Is that true? Do you like my little analogy?
We want to drain the pond. We want to like see what's on the bottom.
You want to see what's on the bottom. You're like, I'm going to go into the scum. Let's go,
Yeah.
let's check it out. Let's dig deep, because I don't know if that's actually going to be a helpful way. So we're going for the scum, people. Okay.
Yes.
So here you are, you get the whole gamut. You're going to test for everything. You're coming in, and where I was going is taking a look at the different ranges and saying, okay, well, Inside Tracker is going to say this range. You know, here in Canada, we have HealthSpan, for example. HealthSpan is in this range. Life Labs is in this range. And is that very common, that it's all dependent on just their population that they're using, or are there CDC or, like baseline levels that they also are kind of saying, okay, well, generally for most people, it's this way. And then are we comparing countries? Because, the Japanese population, or the blue zone people, like they have much better numbers in different things. And are we ever comparing against those populations as well?
Well, I think with and I honestly I don't know Inside Tracker that well.
Mhm.
And I would think that Inside Tracker, and I'm pretty certain that the lab that I use, Vibrant America, which also ships to Canada, they have set ranges that are normal. So they're not looking at everyone they draw and just reporting that. Those are more the conventional labs, the big labs like SnorQuest, LabCorp.
Right.
Yeah.
Okay.
Yeah.
So there are these conventional numbers, and then there's the lab numbers, and then there's the what is ideal for your health numbers. Now, this is
Right.
where I'm really curious about when we're looking at blood work as well, is like, we talk a lot about individualization, right? Like we talk a lot about, for example, like, okay, such a coach question. Okay. So this is how we can, in a truly individualized program, look at, and this was in a podcast recently on Fast Talk, and I was like, oh no, actually it wasn't on podcast, it was on Tennille and Zane's discussion on this particular thing with looking at Athletica. And so what we were curious about in using Athletica AI, so we're looking and researching and trying to understand how can AI be utilized. We're looking at HIIT training, so say a 30-15 versus a VO2 max training. And we're looking at how does the athlete respond, or a threshold training. Let's say it was that. So because in high intensity interval training, just as a quick, like a side note here, you're really spiking the power, you're getting really high power, but your heart rate is more of a threshold level, right? It's not really coming down, and it's really short. So yes, it's spiking up, but on average for that duration of the high intensity interval training, it's this. Some athletes respond really well. Some athletes don't respond well at all. And so they would respond better to having a 4x4 example interval, which is fascinating. Now, is the blood work, this is the question coming in, is the blood work kind of the same way? Is this like, you know what? Your omega-3s are here, and this is okay for you. Like this is working for you, versus somebody else would be like, that is diving you down into the tank and back into the scum. Is that what our ranges? Are there ranges that we have that we can say, you know what? One or the other, you're going to stay fit. It's really okay. But when we're looking for performance, that one person who loves those 4x4s, you're going to elevate if you do this type of workout. So coming back into the question, because I know I'm trying to ask it well. When we think about supplementation, so say your omega-3s, you tested your omega-3s, and you're just be like, you're in range, but you know what? We're going to optimize this by increasing the EPA amount of your omega-3. do we know those things, or is that more of a trial and error, like learning about yourself, learning about your learning about your athlete and how they respond? Is that what your work is as well with your patients?
It's such an interesting question. I wouldn't say with omega-3s.
Okay, bad one.
That's actually I think it's a relatively new test to be doing. And we just want to get people in a sweet spot where they're able to like balance their omega-3s and 6s, take care of the resolution phase of inflammation and supply their mitochondria in their gut with ample omega-3 levels. The one place that I would say that it could be, and gosh, I don't even know if I want to say this on being recorded, but cholesterol levels are somewhat controversial. Like, I think that the high range is maybe like 239. And so many people are getting put on statins when they're at that level. But there's so much more to the cholesterol story than just the total cholesterol. There's a lipoprotein little a, the particle size and number of LDL. And so maybe there are people that function better with a slightly higher total cholesterol number because they make large, fluffy LDLs, or maybe their lipoprotein little a genetically is a little high, and that's throwing the LDL count off. So cholesterol is something that can be maybe fudged a little bit.
Yeah.
The traditional numbers. As far as functionally, like, would someone function any differently? I would say hormones are probably one of those areas. Like some people with thyroid hormone, they may do really well when they're TSH, T3, T4 are within a certain range, but not well when they go low below a certain amount. So hormone levels are definitely something that deserve discussion. Like, how are you feeling?
And the symptoms of it. Yeah. Well, and that is super important to recognize, because I know when at the Female Athlete Conference, and like such huge discussion of saying the period, quite frankly,
Yeah.
It's too inconsistent. The data can't show, although we know that the period matters for your training, it's not showing that it matters. And because it's too all over the place. It's
In perimenopause.
for any female athlete. So
Yeah.
if you're looking at Jane compared to Sam, Jane, she couldn't care less. She can go right through her period and there's no impact. Sam, on the other hand, is like, the week before, everything is just not going to be rosy. Just give me that endurance training, bring it into like just recovery week. I just want to crawl and watch Netflix. Like, who knows? Like, and so what happens is in the research, it goes, doesn't matter, because there's so much variability. There's no consistency in how we look at it. That's due to how I think that individualization, and this is what the research they were talking about with hormones, is like the experience of the hormone levels. And I would also say Dr. Geraldine Pryor, and I linked it in the Facebook group, also gave just a really interesting article. It's just like the precipitous decline of estrogen. It's actually, it's understanding like estrogen in perimenopause just went super high, but it's the actual decline from that is causing such the challenge. So if you go and you get the lab work done and you're saying, oh, your estrogen is really high, but you feel fine, but not so much when you see the cliff. But it's hard to find the cliff when you're doing a one-shot blood work deal.
Oh, yeah. I was talking to someone yesterday about, she said, gosh, in perimenopause, you'd have to check blood levels every day. And I said, really, you'd have to do it 24/7.
Yeah.
Because they're still fluctuating throughout the day. Like, who knows? They're all over the place. And that's interesting looking at estrogen and performance, because I think of testosterone more as the performance hormone. Estrogen can, estrogen progesterone imbalances can throw you off for sure.
Yeah.
I was actually wondering if that athlete that's, really wants to just watch Netflix during that luteal phase week before her period, if she would benefit from like some supplementary progesterone, could be helpful.
Super interesting. And
Yeah.
what would that look like? Is that for all athletes, or is that for the perimenopause? It's like so a female athlete is in their 20s and really struggles. This would have been me, actually. I am sad.
Yeah.
So I didn't actually think about that, and I'll share. So I really struggled up until my period. Like there was a lot of symptoms and a lot of frustration, back pain, like a lot of not great things. So I had tried with the pill, because at that time, that's all the doctors would say. It's like, take the pill. That made things way not good for me either. So then I didn't have that as option. So basically I just suffered for many years, and mood was really impacted as well. So what I'm wondering is, and I've been able to change things a lot, I think, just by being healthier, just like a lot of those things, but also taking ashwagandha, and I have quite the, magnesium, bringing that up. I have omega-3s, I brought that up. I have like my I also am taking chaseberry Vitex, which I think has really, really changed the story for me. So what I'm saying is that thought of that imbalance, because I worry about an idea of an imbalance. Like, what is imbalance referring to if we're taking a look at this blood work, because that's what we're talking about today, but we're looking at hormones now, and we're saying, okay, well, your estrogen is really high compared to your progesterone. It's just not coming up, or it's whatever the imbalance. Maybe your progesterone's way too high. I don't know.
I think probably, anyone that has these symptoms around their period, it's generally estrogen dominance. So adding back a little progesterone can be really helpful. And estrogen dominance, for whatever reason, they're not clearing it, they're recirculating it from, like, when estrogen gets cleared, it gets taken into the colon, and then there's some bacteria that can re-release it back into circulation. So many different places that the estrogen levels can be high, many different causes. And some, adding a little supplementary progesterone can help. And that's what chaseberry does. That's what Vitex does, is it increases the progesterone released from the ovary.
Oh, there you have it, ladies.
Yeah.
That's why it works.
And I want to interject one more thing while we're on this menopause topic, because we're the perimenopause, menopause people.
Yeah.
I've noticed that that change, that shift into menopause, into like, boom, when you like really get it, the labs in a woman shift dramatically. The cholesterol levels that used to be great, they go up. The A1C, the hemoglobin A1C that used to be like fine, didn't have to worry about prediabetes, like shoots up, like right, almost prediabetes or into the prediabetes range. All those cardiometabolic kind of labs really start to change. And it's the loss of estrogen. I don't know if it's a loss of estrogen or the change in the microbiome that really bring those on, but they're both happening at the same time. And it's a marked change.
And have you, because that I've definitely read that and know that to be true. And I remember Val Schonenberg. So she was a registered dietitian that I spoke to, and she didn't, her approach was like, yes, those numbers are going to go up, and they're going to shift when your body shifts again. So when we come into care of, say, a functional medicine doctor, and we notice this labs being abnormal, how much do we say, all right, let's take a healthful approach and see how your body responds to, because you're right, like it's such a chaotic decline of estrogen. It's not, it's dominance, it's not dominance, it's like it's all over the place, right? It changes so much. How much do we have to, is it about taking and supporting our health through good practices of exercise, balancing with intensity and endurance? Is it good practices of nutrition that you predominantly go on? Or do we need to, or is this where we can smooth it out with supplements and support our body that way?
I think just lost train of thought. I think that the most important part during that whole transition time, all of that, yes, all of that, and then really developing an intuition and tuning into our bodies and following what's happening day to day. I've found a very mindful approach. Like, what is happening right now? Not like, oh, this is different, or it's never been this way before, or, just what is happening now, and what do I need now? And yeah, living day to day, moment to moment, understanding that our body is not the same body that it was 20 years ago or yesterday.
So when you say that, because yes, I completely agree, and that's how I definitely coach. Is it when you come to, and I guess what I'm trying to get at now is a nuance to that question is, I'm in front of my doctor now, and my doctor has actually, amazingly asked for a suite of whole blood work, and or do we, what is it, a phase? Do we wait and see, or do we act? And I guess I think I know the answer. Maybe it is, what are your symptoms? Is it changing your life? Is like, how is it that you're really being impacted? And if you are not able to live the life in which you are inspired and able to do the things that you want to do, love on your family, would just be one, like, like I needed to find a solution. I know that I needed to find a solution, and it was getting worse for me, and worse and worse and worse as I come into early perimenopause. Like it was not good. So it was a problem, and I found help.
Yeah, I usually tell people like a lot of times perimenopausal women will come and they're just not feeling well, and we start to supplement with some progesterone, and then they come back and they say, oh, so much better, everything's back to normal. And I say, that's great. Let's check in 3 months, because it might not be. You
Right,
might need
because it'll
more.
shift again.
Yeah, you might need less. You might start having regular periods again. And what do you do then? So send me a message. I communicate through Portal. Yeah, let me know what's going on, and we can meet again sooner than this if we need to.
That's brilliant. One of the last things I want to say is one of the things that we work on, you and I, like, and how we're doing it is, what is it? And I guess to this point is, what is it that we can take care of on the things that I do and I support my athletes in? Is this like a really solid training plan that you can find consistency, energy, and have other priorities in your life? And nutrition, which is nourishing of those activities and nourishing of your body from a bone health and muscular and all those things. And then when is it, and you've already pointed to this, but I want to hammer it home. And then when is it that we go and need to see and go to Dr. Beth and say, there's something that we need to investigate further? And it's understanding those behavioral changes to, this is a genetic thing that we need to actually dive deeper into, or we need to look at, you're really suffering with your symptoms. Progesterone is an answer. And that there's the divergence right here. Not everything, I guess, to my point, and maybe I'll find a question in here. can be solved by exercise, like good, solid exercise and nutrition. It can go a really, really long way.
Yeah, it can go a really long way. And if you have good genes, it can go a really, really long way. And if you don't, I tell people, many people don't understand how close to the edge of the cliff we're living.
That's
So,
amazing.
so people can keep going and they're living far away from the edge of the cliff. Some people, it takes the smallest little trigger and they're like off in something. That's why it's always good to look at the blood work and see where are you about to become a cliffhanger.
That's a great thing. So we're getting into the swamp. We're gonna we're gonna check out all the sludge, and then we're gonna take it and see, are you on the edge of the cliff?
Yeah.
We're all very natural.
Yeah.
We're all in the natural environment still. Is there anything to this topic? I'm going to ask you another question, a follow-up question about what you're up to these days. But is there anything else that we've missed in our discussion of looking at blood work that you think that is really important that you want people to know about?
Yeah, I want people to know that I've had people come into the office because we let them look at their results before their appointments so they can have questions and we can address things. I've had people come in tears because things are abnormal or something was high, and it's just data. It's nothing personal. Doesn't mean you're going to die. And if something's alarming, we'll refer you to the right person. But knowing where the edges are, knowing where the boundaries are and where we're starting to overstep, that's what's key. And being able to see what's happening and turning things around before it gets to a disease state, that's what's beautiful.
Yeah. It's where healthcare has to go.
Oh my gosh, when I see thyroid antibodies reverse and go back to negative, it's like, oh, it brings tears to my eyes. I love it.
I don't know what it's like in your area, but basically stay out of the hospitals, people. You don't want to be there. Public health announcement right here. Stay out of the hospital because they're really good at what they do. And it's not health.
It's sick. You have to be sick to be in the hospital.
It's sick. And so yeah, and we can do so much now. We have such powerful tools and we have access to it. And yes, a lot of it is coming down to our own pockets. And I'm speaking from as a Canadian. And yes, it's hard for Canadians to think that we actually have to pay for healthcare because what we're paying for is disease care. We don't pay for healthcare. We pay for disease care. I came up with that. I just was not smart. We're paying for disease care. We're not paying for healthcare because if health was actually what we were doing, then we would not be spending money the way it is being spent.
Right. Exactly. Mark Hyman calls it sick care.
Sick care. Yeah, actually, that would be a better word. Sick care.
Sick care.
But you can be sick and health. Like you can get sick and still be in health.
Yeah, you can.
You get the flu. That's your immune system coming back stronger. Beth was like, I don't know about that, Tamil.
Yeah, sure. We optimally want an immune system that'll like just take that virus and extinguish it before it makes us sick.
But okay, can we go off on a tangent just for a moment for all of us? Okay, just because I think it's interesting. Okay, so think about the time that everybody was like huddled into their own homes during COVID and nobody was getting sick because we couldn't see anybody. And then the first time you get sick was absolutely brutal because our immune systems weren't fighting off anything other than our own like little, like whatever issues that we had within our own four walls. And it was bad. like, I would rather get like having to constantly fight off. There's like, oh, there's one, let's fight it off. Oh, there's another to fight it off. And I'd like my immune system to keep working at it rather than having bombarded with this. Like, is that what happened? Is that what happened? Like, our immune systems weren't having to continuously keep up with?
I don't know. I think we were all getting really well rested.
But and then we went back into the world. Okay, well, there you have it. About the real reason.
Although being in lockdown was pretty darn stressful, reading the news.
Yeah, I don't know. Well, so we're kind of rested. I'm not sure. In any case, I have taken this on to another plane. Beth, all right, my last question for you is this. Okay, we already know where you can find like we now know that where we can find you. Okay, once more. Let's talk about
on my website, flagstafffunctionalmedicine.com.
Yeah.
And let's talk about menopause.
Let's talk about menopause. And what do you have that you are really excited about right now?
I have an offering right now that includes the foundational assessment, the labs. We're bringing in a course of Ayurveda and a community of women and working through Ayurvedic, which are really basic. It's a basic concept of health. I did actually a Facebook Live. I delivered a speech that I delivered this week to a group of people that didn't know anything about Ayurveda. It's finding balance and becoming our own best caretaker. And then also in that grouping is an 8-week mindfulness-based stress reduction course. So learning how to meditate. So it's a 6-month program.
Oh, who doesn't want some of that? All right. You know where to find her.
Yeah.
Flagstaff Functional Medicine. And let's talk menopause. Thank you so much for coming on and for journeying on this rather kind of random and roundabout, maybe perimenopausal discussion, total perimenopause discussion on blood work. It was perfect. Thank you.
Thanks, Danielle.